Sure. Check, check, check. Check, check, check. 10. Ah, excellent. Okay. Admin settings. Yes. Good. 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 Okay. Monitor 2. Content far near. Monitor 2. Content far near. Monitor 1. Far content.
clinical psychologist with UPMC and spends a lot of her time at McGee and some time at Passavant, and specializes in oncology and has been at McGee for 20 years or so. So without further ado, I'll introduce Dr.
Hello, thanks for coming and joining us for the next however much amount of time this takes. It's great to see you all here. So they've asked me to talk about coping with fears of cancer recurrence, and I'm going to just kind of go through sort of what that is, some of the research that's available about it, and then some hopefully practical solutions that you can use if you're having fears of cancer recurrence. So you would think that fear of cancer recurrence would be a pretty straightforward idea, but there actually have been some discussions about what it really is. Basically, it can be defined as worry or concern that your cancer may come back, progress, or metastasize. But a couple of the studies have actually sort of tweaked it a little to say that it can be defined as a perceived risk of cancer recurrence, which is disproportionate to the actual risk of recurrence. Because as we know, unfortunately, cancer can recur, so worrying about it recurring is actually a normal thing to do. So in some of the studies, they've looked at, are you worrying about it more than the actual risk? And it can take many forms in different people. It's not necessarily always just a fear of recurrence itself. It could be a fear of dying from a recurrence. It could be a fear of needing further treatment, having your life disrupted again, and being able to fulfill general life obligations. So even though it's kind of one concept, it can take many different forms. Often people experience FCRs, just fear of cancer recurrence, can be experienced by worrying about seemingly minor symptoms. A lot of people say to me, gee, now that I've been through cancer, I worry about every little ache or pain that I have. Stomach aches, headaches can bring up those fears. And then the fears often start as you're finishing active treatment, because a lot of people feel like when I'm in active treatment, I have a lot of people supporting me, checking to make sure everything's okay. Once you're done with treatment, everybody just kind of expects you to go back to normal. But it can be scary to think about not having as much medical oversight as you had during active treatment, that your treatment team is kind of your safety net, and sometimes that you're no longer actively fighting the cancer. So that's oftentimes when these fears start to come up. So depending on how you measure it, between 22 and 99% of individuals who have had cancer have a fear of recurrence. I'm interested in who that 1% is who doesn't, but it can happen to anyone, regardless of your age, what kind of cancer you had, how long you've been done with treatment or been a cancer survivor. Anyone can develop it. But there are certain triggers that tend to bring it out. Oftentimes, if you're having a follow-up scan or appointment, those fears start to creep in. Ooh, is my doctor going to tell me something bad? Am I going to get bad news? Anything that reminds you of cancer. So for breast cancer patients, October is often a hard time because it's Breast Cancer Awareness Month. So it's kind of back in your face again and can kind of stir things up. Or if you hear of somebody else being diagnosed with cancer, that can stir it up. There is a thing called an anniversary reaction, meaning on the anniversary of an event, anxiety can kind of crop up. Could be something in the media. It could be a report on a new kind of treatment or anything related to cancer. And it can be triggered if you develop any kind of new physical symptoms. So there are a lot of things that can bring up that fear. There was a study last year that suggested that fear of cancer may be related to general health anxiety. So if you think about sort of fears of recurrence, oftentimes maybe you have a test coming up. It could be a mammogram, a pap smear, whatever. leading up to that test, the anxiety kind of builds. Hopefully when you get good results from that test and everything comes out fine, the anxiety comes way down again, but it may start creeping up again. And for people with just general health anxiety, this holds true even with non-cancer related tests. So if you have to have a routine colonoscopy or you have to have a stress test, it's that kind of same trajectory of leading up to the test, you're anxious, get good results, anxiety goes down, and then it can kind of come back up again. So there are, in the research that they've done on fears of cancer recurrence, some factors that tend to be associated with developing a fear of cancer recurrence. Younger age, which kind of makes logical sense. I mean, if you're pretty young and have young kids, you might be more afraid of what could happen if your cancer comes back than if you're older. If you're still having physical symptoms after finishing cancer treatments, particularly any that affect your quality of life. So if you're having fatigue that keeps you from doing the things you want to do, or pain that keeps you from doing activities you want to do, that might bring up some anxiety. Low trait optimism, and to just explain what that is, many things like optimism, anxiety, things like that are kind of looked at either as a state or a trait. So a state of, say, anxiety is like if you have public speaking anxiety, you're in a state of anxiety while you're doing the public speaking, but it goes away. Versus if it's a trait, anxiety, it's more like you're kind of a born worrier and you're anxious throughout your life. So people who are low in trait optimism, who weren't born very optimistic in general, tend to have more fears of recurrence. Family stressors can bring it out. Feeling vulnerable. Unfortunately for females, females tend to have higher fear of cancer recurrence. Low income, having additional medical problems. Obviously, having an anxiety disorder to begin with, you're more likely to be anxious about all kinds of things. And people who are dissatisfied with their medical care. So again, that kind of makes logical sense. If you feel like, gee, I'm not sure I got the right treatments, or I didn't have the greatest rapport with my physicians or my medical team, then you might be more fearful that maybe something that you should have had didn't happen and the cancer might come back. So these all are kind of logical, but this is kind of what the research has shown. Protective factors, so things that make it less likely for you to have fear of cancer recurrence, are trait optimism. So if you're just generally an optimistic person by nature, you're more likely to think, well, maybe it won't come back. Having good social support, being kind of in a community with people. Active problem solving, so when you have a problem, kind of doing something to solve it rather than kind of avoiding it. Expression of emotion is an interesting one, because a lot of times if we have feelings of anxiety or sadness, we're tempted to kind of keep it inside. But actually that ends up being problematic in the long term. So people who are able to just kind of put it out there like, yeah, I'm worried about this. Yeah, I'm concerned about this, tend to have less fear of recurrence. Benefit finding, being able to find something positive out of a negative experience. So people who can look at their cancer experience and say, yeah, it was bad, but now I have a better sense of my priorities, or now I'm closer to my family. Those kind of things might make you less fearful of recurrence. And religious and spiritual beliefs. If you kind of feel like somebody up there is looking out for me, or this is the plan, this is how it's supposed to be, you may be less fearful. Again, some of those are kind of common sense. And an interesting associated factor, there was a study in 2013 that indicated that both minorities and individuals who are high in spirituality perceive a lower likelihood of recurrence, and they're thus less fearful. So if you think, my odds of recurrence are pretty low anyway, you're not going to be as fearful of having a recurrence. And interestingly, spirituality and being in a minority group apparently is associated with that. So in the long term, we hope that over time, as you finish your cancer treatments, as you get back into your normal everyday routines, as reality sets back in, we hope that the fear of having a recurrence diminishes. And there's kind of a continuum with any problem. Is it a problem we have to do something about, or is it just kind of there? If some of these factors I'm going to talk about are present, it may indicate that, yeah, this is kind of a problem that we actually need to deal with. So if you're having trouble just doing your daily activities or kind of moving forward with normal life, that may be an indication that, gee, this fear is kind of taking over. Some people feel like they just can't shut off the worrying, that their mind, it just goes around and around in their mind, and they can't shut off those fears. If the worrying is affecting your sleep, your appetite, your cognitive functioning, meaning like your memory, your attention, concentration, if the fear remains at a high level all the time, if the fear keeps you from avoiding people or situations or medical follow-ups. So, again, when we talked about the normal kind of trajectory of, say you have a scan coming up, you're going to be anxious about it, but then the anxiety goes away. But if you're so anxious that you say, I can't even have that scan because I'm just too anxious, or I can't even go back to the cancer center because it just makes me too anxious, that's, an anxiety that we need to probably do something about. And another one is hypervigilance, which just means paying more attention to something than you need to. And how that sort of comes out is like, for example, you might every day be kind of taking a mental inventory of how do I feel today, or you may be doing like breast self-exams every day or twice a day or things like that. So if there's like too much focus on the physical part, all of these things could indicate, yeah, we maybe should kind of do something about this fear because it's affecting your daily functioning. So there are many different ways to cope with fear of cancer recurrence, and I'm going to kind of guide you through some of the research on this, and then we'll kind of talk more about sort of some practical applications of it. Unfortunately, although there's a lot of research in general on fears of cancer recurrence in terms of who's more likely to have it, how long does it last, that kind of thing, there aren't as many studies about how to fix it. So unfortunately, there's not a ton out there on this, but I'll give you what there is. So one of the first studies I could find on this issue was from 2010. Pretty big study, 265 cancer survivors of mixed types of cancer. And it compared a 4-session cognitive behavioral group, and I'll tell you what that is, with a supportive group and a control group. Cognitive behavioral therapy is kind of the gold standard therapy for anxiety and depression these days, and it's based on the idea that the way we think about things affects how we feel emotionally. So if we're thinking about something in a worst-case scenario way, we're probably going to be more anxious or depressed than if we think about it in a more neutral way. It's kind of it in a nutshell. But so they compared groups of people who had this very specific training on how to look at the way you're thinking about things and see, if there's a better way to think about it, versus just some support, kind of talking to each other and supporting each other, versus a group that didn't get either one. And although all of the groups showed some improvement in fear of cancer recurrence, the cognitive behavioral therapy groups showed a significant long-term improvement. So the other groups improved right after the intervention, but over time the fear kind of came back. With the CBT group, they had significant long-term decreases in the fear. Mindfulness is something that you may or may not have heard of, but it's kind of gaining in popularity lately. It's been around for a long time. There's been a lot of research on it, but they're now starting to apply it to psychotherapy. So in 2009, they did a study of 82 survivors using a 6-session mindfulness group versus a control group, a group that didn't get the mindfulness training. And again, the mindfulness intervention group had a significant reduction in fear of cancer recurrence, anxiety, depression, and improved quality of life, which is not surprising if you look at the general literature on mindfulness, that it has had tons of research support for helping both physical symptoms like pain and emotional symptoms like anxiety and depression. So this study kind of held that up, specific to the fear of recurrence. This was an interesting one, a study they published last year looking at breast cancer survivors, which a lot of studies are actually done on breast cancer survivors and patients because there's a lot of them and there's a lot of press about breast cancer. So I know that's frustrating for people with other kinds of cancers. And hopefully they're going to start applying this stuff to other cancers. But in this specific study, it was just breast cancer survivors. But they randomly assigned people to either a gratitude intervention or a control group. In the gratitude intervention, what they did was just had people spend about 10 minutes writing a letter to someone in their life that was important to them to say thank you to that person. So easy enough, easily done. And sure enough, the people in the gratitude arm of the study experienced significantly decreased death worry and increased meaningful goal pursuit, meaning they were kind of able to move forward in their lives better and find and pursue things that were meaningful to them. And when they looked at why did this gratitude study work, why did this gratitude intervention work, what they found is that people were able to start to find meaning in their cancer experience, kind of being able to answer that question of why did this happen to me? And it helped them have a sense of purpose, that, yeah, there's something in this world I'm supposed to do. And people who were able to get that mindset did better with the fear of recurrence. Because I guess if you think about it, if you feel like, okay, I've kind of found my niche in the world and this is what I'm supposed to do, you put your attention there rather than on, oh boy, what's going to happen in the future. So I think that kind of actually makes sense. Another couple of studies that are out there. In 2016, there was a pilot study, which basically means kind of a feasibility study. That included 56 women with breast or gynecological cancers. And they used some of the strategies from like a cognitive behavioral, what do I want to say? I can't think of the word now, I just went blank. From a cognitive behavioral viewpoint, but they added a few extra things in. So they did talk about, how your thoughts affect your feelings. But they also included things like being exposed to distressing information. So that kind of goes back to the avoidance thing of like when something traumatic happens to us, we often try to just put it out of our head and avoid it. But unfortunately, that ends up backfiring and just making the problem bigger. So in a lot of groups where people have had traumatic events, and I would argue that being diagnosed and treated for cancer is a traumatic event, forcing yourself to kind of confront that and confront things that remind you of it actually in the long term is much healthier. So this group kind of included some of that strategy. And it also included some relaxation strategies. And sure enough, again, the intervention group had reduced fear of recurrence and reduced overall distress. So we're starting to see a trend that kind of doing something to help your fear of recurrence is better than doing nothing. This is a teeny tiny study, but it's kind of an offshoot of the last one. So in the previous study, they looked at groups of people and giving them this intervention. This was a little pilot study with just 3 patients in it to see if it was feasible to do individual therapy using those same skills that they used in the group intervention. And, bottom line is 2 out of the 3 people did better with the individual intervention. But obviously that needs a lot more research. There was another kind of interesting study, not so much an experimental study because it didn't involve like a control group and an intervention group, but it was a qualitative study, meaning we're just trying to look at trends. So they use a semi-structured interview, so they have kind of a list of questions that they kind of work off of, but they can take it different directions, with 30 young breast cancer survivors, just to learn about how do people try to cope with fear of cancer recurrence. And what they found was that there were a wide variety of strategies that people were using. Spirituality, distraction, some of those cognitive skills, positive thinking, avoidance, making lifestyle changes like changing your diet or starting an exercise program. People were using complementary therapies like acupuncture, Reiki, that kind of stuff, relaxation, support, downward comparisons, meaning you say, gee, things could be worse. I had this, but there are other people who have it worse. That's a downward comparison. And what they found with the women who had a lower fear of recurrence tended to use a bigger variety of coping skills, and they used less of the distraction and avoidance, which I kind of alluded to before as maybe not the best coping skills. Interestingly, they also found that the women who reported higher fears of recurrence tended to feel like the coping skills they were using were very burdensome or tiresome. So, for example, somebody who made elaborate dietary changes, cutting out all kind of stuff, being very, very specific and measuring everything and whatever, like they're very time consuming. And unfortunately, I think that's it kind of ends up not being that helpful. So it's just interesting to see the wide variety of skills that people are using. There's a couple of studies in the works looking at skills-based training for couples, where one of the partners has had cancer, and they're also doing a study of kind of telephone coaching, doing sort of an intervention by phone rather than in person, that look promising, but they're still in the works, so we don't know how they're going to play out. But that's kind of where things are moving. So does that all kind of make sense so far? That's kind of the nitty-gritty research stuff. On a practical level, I think kind of using the information we've gained from the research that's been done, as well as just kind of having been here for a while and seen all the varieties of ways people cope, here are some things that many people have found to be helpful on a practical day-to-day level. The first one is kind of continuing to work closely with your medical team to create some structure for yourself. So I'll often have people who say, I had this pain in my arm, it was really bothering me, I was afraid it meant that I had a recurrence, I didn't know, should I call, should I not call, I don't want to bother my medical team, but if it's something bad, I want to know. So sometimes people come up with a kind of a rule for themselves, like, I'm going to watch this symptom for a couple of weeks to see if it goes away on its own. If it does, great. If not, after that 2-week period, I'll call my medical team and check in with them. I mean, obviously, if it's a bad thing, like if you're fainting or something, you shouldn't wait 2 weeks. But things like, aches, pains, that could be attributable to a cancer recurrence or could just be that you overdid it one day, gardening or moving furniture or whatever. So I'm not saying that the 2-week rule is good for everybody, but I'm just saying some people come up with a rule like that to help them kind of decide, should I call or not call? And if you have any doubts, don't hesitate to call your medical team. That's what they're there for. And I think by and large, they would rather you call and get some reassurance if you can, rather than being at home, wondering and being afraid. Your medical team is also a really good, reliable source to educate you on what you should be looking for as a sign of recurrence versus something that isn't. So by and large, a pain in your thumb is rarely indicative of a cancer recurrence because most cancers don't work that way. But if you didn't know that, you might be like, oh my gosh, I have this pain that's not going away, I should call. So if you've talked to your medical team about what kind of cancer do I have, where, if it's going to come back, how is that likely to happen? Is it going to come back? Am I going to get headaches? Am I going to get, is my blood work going to be off? If you kind of know specifically what to look for, then you don't have to worry about some of the stuff that comes up anyway. So it's never a bad idea to kind of get a sense from your team as to, this is the stuff you should worry about, this is the stuff maybe not so much. Regularly attending follow-up appointments and completing your follow-up tests. Again, it's probably going to raise your anxiety level because there's always that chance that you're going to get a bad result from the test. However, what most people find is if they have the appointment or test and it turns out good, they'd rather have that than be wondering, ooh, is it good or bad? But also, as many people also say to me when you're kind of thinking about it, if there is something there, I'd rather know sooner rather than later. So even though that anxiety might be really, really high going into the test, either you're going to get a good result, which will ease your mind, or you'll know sooner rather than later that something's up that we need to take care of. Another thing is taking advantage of the resources at your cancer center. Here we have the Live Well Survivorship Clinic, which is staffed by a medical oncologist, but is a sort of holistic clinic. So they look after your cancer stuff, but they also look after the other stuff, like your bone health, your heart health. So if you have a kind of survivorship clinic at whatever cancer center you're at, that's a great resource. Distraction, keeping yourself and keeping your mind occupied is good, because if those kind of thoughts are running around in your head all the time, sometimes, since we can only think of one thing at a time, if you put your focus on something else, then you, by definition, can't be thinking about, oh, what's going to happen with my cancer. However, the caveat is, as I alluded to, completely avoiding thinking about it or feeling anything about it is not healthy. So it's good to kind of build in some time for processing, but also giving your mind a little break too. So sometimes people will actually schedule time. I know this sounds crazy, but it's an actual thing, scheduled worry time, that every day at maybe 2 o'clock, you take 15 minutes to worry as much as you can and as much as you want to about cancer recurrence or whatever you're worried about. Then when that time is up, it's like, okay, I'm going to shut that off for now, and tomorrow I know at 2 o'clock I can worry about it again. I know it sounds kind of funny, but it actually is a pretty effective technique for some people. So it's kind of finding that balance between, yes, I need to process this experience, but no, I don't need to be thinking about it 24/7. Controlling the things you can control, because a lot of aspects of cancer feel like they're out of our control, and many of them are. But with any general stress, our stress level increases the more we feel like we lack control. So the flip side of that is the more things you can control, the more your stress comes down. So even though you can't control what this cancer is going to do, you can control, hey, maybe I should start a regular exercise routine, because as we know with some cancers, exercise and body weight is related to risk of recurrence. Seeking information is something you can control. So you can choose, hey, I'm going to call my doctor up and ask them about this, that, or the other. You can control whether you attend your appointments. You can control whether or not you start to do some stress management practices, relaxation, meditation. So there's actually a lot more in our control than we think. And if you even take it to a micro level, like we can control what clothes we put on when we get up in the morning. We can control what we eat for breakfast. We can control how we spend our time during the day. So if you need to even think about it on that level, there's a bunch of stuff we can control. And the more you kind of do that, the better your stress level is. I can attest to that, and I had a student who I'll never forget. She was taking the licensing exam, and back in the day, you didn't get your results right away. You had to wait 6 weeks or something. So since she couldn't control what was going to happen with those results because she took the test, so it's over, she was baking up a storm, which I reaped the benefits of because she brought in cookies. But it really helped her reduce her stress because she could put her time and energy into producing all those cookies. And luckily, she passed the licensing exam, so that was a plus too. But so it may be little things that you do that make a big difference. So I talked a little bit before about mindfulness meditation. There was the study I alluded to that said it was helpful. And since it is kind of, I hate to say it's new and up and coming because it has been around for a long time, but it is gaining popularity in the general population. So I thought I'd say a little bit more about it. It's a particularly useful type of meditation that, again, has significant research support, both for helping physical symptoms like pain, lack of energy, any physical symptom, as well as emotional symptoms, anxiety, depression, anger, all that stuff. And they're actually sort of now studying adding it on to cognitive behavioral therapy, and they're finding that the two together are even more effective than either by itself. So they're doing a lot more research on this. And generally speaking, there are two main components to mindfulness meditation. One is having a here and now or present focus. Because if you think about it, we really can't control the past and we can't control the future. All we can control is the here and now. And also, again, thinking about we can only think one thing at a time. If we're totally focused on the present, we can't be thinking about something you're worried about in the future or something that happened in the past. The other main aspect to it is this idea of non-judgmentalness. And how that plays out is a lot of times if we're feeling a certain thing, so say you have a headache, oftentimes we then judge that by saying, I have this stupid headache. When is it going to go away? It's ruining my day. Why do I have to get these headaches, et cetera, et cetera. Unfortunately, what that does is puts the spotlight on that headache. And anytime we're focused on something, we notice it more. So unfortunately, you're putting the spotlight on it, you notice it more, and you suffer from it more. It's sort of like adding insult to injury, if you think about it that way. Same thing goes with like anxiety. Like, why do I have to be so anxious when I have to talk in front of a group? Why can't I just get up there and be so, perfectly fine? Again, it just puts the spotlight on it, and it's not helpful either. Like beating yourself up over stuff doesn't really help us. We rarely get motivated by beating ourselves up. And someone who I wish I could take credit for this, but I read it somewhere so I can't, said that judging our feelings and our thoughts is like being shot twice. The first shot is the pain you're already feeling. The second shot is the judgment you put on top of it. So if we can find a way to notice what we're feeling without heaping on that judgment, it makes what we're feeling seem less severe, if that makes sense. So there's a lot of different levels of mindfulness meditation, but on a basic level, it's the kind of meditation you can actually do as part of your everyday normal activities, which is kind of nice because a lot of people find it hard to find time to just sit and meditate or sit and do deep breathing or imagery or whatever relaxation technique you might want to do. So this is one that you can kind of do as you're going about your normal daily activities. And how you do it is just by keeping a running dialogue in your head of what you're noticing in the moment. So say you're taking a walk. Say you're walking from here back to your car at the end of this. You can make that a mindfulness meditation. So you could think about, right now I'm noticing how my feet feel as they're hitting the ground. Right now I'm noticing that as it changes from carpet to linoleum, it feels different. Right now I'm noticing that as I'm walking down the hall, I can feel the air moving past me. Right now I'm noticing that there's somebody down the hall that has a hat on. It can be whatever. I mean, it can be whatever you're noticing in the moment. But by keeping that running dialogue, it's helping you stay focused at that moment. Now, of course, our minds are very busy and they like to wander. This is where the non-judgmentalness comes in. Because say you're, doing your mindfulness walk and you're walking along and you're thinking about your feet, and then all of a sudden you're thinking about, ooh, and I have that appointment tomorrow I have to think about. Non-judgmentally notice, oops, my mind wandered, and bring it back to the walk. Some days you may have to do that a lot, hundreds of times, because our minds are very busy sometimes. Other days you may have a much easier time staying focused, and you may not have to pull yourself back that often. But by practicing pulling your mind back to the task, it's almost like an exercise for your brain. The more you do it, the easier it gets. So it may end up helping your concentration because you're training your brain to stay focused. But it's also on a meta level important to be non-judgmental about your practice too, because on any given day you may be doing your mindfulness meditation and you may feel terrific and relaxed, or you may feel like, oh, my mind just kept wandering the whole time. If you let yourself kind of beat yourself up and say, oh, I must not be doing this right, it's not working, you might give up too soon. And so I would say, if you're going to practice this, if you have a bad day at it, the next day's a new day. It might be better, it might be worse, but over time, if you keep practicing, you'll have the benefits even if you don't have them on any specific day of practice. So you can use this as an eating meditation. There's a guy who is the kind of big mindfulness guru in the United States, Jon Kabat-Zinn, who does a raisin meditation that's like, I forget, I didn't measure it, but it's like half an hour long. And you're thinking, how could that be? How could you think about a raisin for half an hour? But weirdly enough, you can, because when I was in internship, our training director did it with us. And funny enough, I had a headache when we started and it was gone when we finished. So I can attest to it works. But it's about sort of looking at the raisin and kind of feeling the weight of it in your hand and looking at the wrinkles and looking at the color of it and then noticing how it feels to bring it up to your mouth and noticing the smell of it and noticing the taste of it on the tip of your tongue, et cetera, et cetera, et cetera, to the point of like noticing how it feels to have swallowed the raisin. But it's amazing how like you get yourself lost in this meditation. And interestingly, kind of we all occasionally do mindfulness just without even knowing it. If you've ever been, say, reading a book and you get lost in the book and like it's a half hour later and you didn't even have time passing, that's a state of mindfulness. We just didn't know we were doing it. So we all can do it, but practicing doing it helps you get better at it, and also in the long run helps you tolerate things like anxiety or pain better. Because it's also, in the bigger picture, about being able to kind of notice stuff and let it go without hanging on to it. So again, this is not original to me, but somebody I work with was watching a podcast on mindfulness, and they used this example of being in a train station. And if the trains are all these thoughts that you're having, you can just let the trains go by, or you can jump on one, but that train might take you somewhere you don't want to go. So it's like jumping on a train of thought of like, oh, well, what happens if this? Well, if that bad thing happens, then this might happen, and then this might happen, and you're snowballing, and finally you're somewhere you don't want to be. So mindfulness is also about not jumping on a train of thought, not putting all that focus on it, just letting thoughts pass without judging them, just letting them come and go, like a train in a train station. So I thought that was pretty smart. So if you find that you're someone who has a fear of recurrence and it's getting in the way of your daily life, there are a lot of different ways you can go to get help with that. Many large academic cancer centers have a psychology department, a psychiatry department, patient navigators. Here at UPMC, we have my department, which is the Center for Counseling and Cancer Support. And there are also people in private practices across the community. So it's never a bad idea just to kind of, even if you're not sure, like, is this, normal or not normal? It never hurts to check in with somebody and just put it out there and see what you think, because a lot of times just hearing, yeah, this is a normal thing, this is something that up to 99% of cancer survivors experience, sometimes it feels better to just know that. So it's never a bad idea to meet with somebody if you feel the need. There are a lot of support groups out there. Again, here in Pittsburgh, our clubhouse and the Cancer Caring Center. But again, most cancer centers throughout the country have support groups or know where they are. A lot of hospitals and agencies like the American Cancer Society also have peer supports, people who have been through cancer themselves and who are trained to help people out. The new kind of big thing is telephone support services and actually some online support services. So here at UPMC, if you happen to have UPMC insurance, they have telephone coaching for stress management, weight management, exercise, that kind of thing. And there's an online depression management program, Beating the Blues. I think a lot of the major health plans have something like this. So if you're somebody who can't get out of the house very much or doesn't feel comfortable interacting with groups of people, you may just want to call up the member services number on your insurance card and see if anything like this exists wherever you are. And it's usually built into the cost of your insurance. So oftentimes these telephone and online services are free also. I alluded to the survivorship program here at McGee, and I put the website on there. I like, there are a lot of great resources online, but you want to make sure you're looking at legitimate ones. So the Mayo Clinic and the Livestrong Foundation are very legitimate agencies who have stuff online about fear of recurrence. Here in Pittsburgh, the Cancer Caring Center and our clubhouse, which in various places is known as Gilda's Club. Often, again, these have information that's free that you can either download or access otherwise. And then I alluded to mindfulness, John Kabat-Zinn being kind of the big name in mindfulness here in the United States. I have no vested interest in you buying any of his products. I'm not related to him or anything, but he has a couple of books out on mindfulness for beginners. There's some CDs on practicing mindfulness. And probably if you go on Amazon, there's countless things on mindfulness out there. One of the studies I alluded to was talking about the cognitive behavioral therapy, which is, again, kind of how our thoughts affect our feelings. And there's a classic book out there, The Feeling Good Handbook by David Burns. It's kind of a workbook on learning the different ways we think about things that aren't helpful and learning how to challenge those unhelpful thoughts. And I like this book because it's divided into sections. There's a section on anxiety, there's a section on depression. So if you're not depressed, you don't have to read those chapters. But there's also a great chapter at the end on dealing with difficult people, which I'm sure we all do in our lives. So even if you go to the library and check out that chapter, it could be very interesting. And if you want to know more in general about cognitive behavioral therapy, the guy who invented it is Aaron Beck. He's still alive. He's like 98 years old or something and still doing seminars. But he and his daughter started an institute about cognitive behavioral therapy, what it is, how it applies to a variety of situations, and they have a great newsletter on their website. So if you're kind of interested in a more kind of academic view on it, that's a great website to check out. And I think that's it. So I don't know if there are any questions out there.
I have a question about going back for the first yearly visit.
Mm-hmm.
When I was diagnosed with breast cancer, you couldn't feel it. None of the doctors could feel it.
Right.
And I was told by several of them that I had such a good radiologist that it was really, he did a good job seeing that because he could have really missed it. Now,
Right.
when I go for my follow-up, that's when I'm going to be worried.
Sure. Yeah. Yeah.
Should I have him again?
Yeah, I would.
But I'm concerned about that.
Oh, right. So the question was that, if you've had, if I can put it in a nutshell, if you've kind of had a cancer that was sort of difficult to diagnose to begin with, you might be maybe extra concerned at that first year follow-up about, are they going to find it, given the first one was hard to find? Is that fair?
Yes.
Okay. Kind of what you do about that. I guess the short answer is it kind of, in some ways, follows that whole control the things you can control. So if you feel better going back to that same imaging place and getting that same technician, and you can, go for it,
But I don't think that's
Right.
one of those things that you can
Yeah,
get the same radiology.
exactly.
No.
Yeah. And that's a really tough question, I think, because, nothing is 100%. And I think the best you can do is kind of, if you feel like you're in a good, even if you don't get the same radiologist, if you feel like you're in a good cancer center or a good imaging place, it's kind of like you almost have to kind of take that leap of faith. But that's kind of a wishy-washy answer, but
That's about what I was thinking I'd have to do, but,
yeah.
Still, that just because it was, such a surprise that they did catch it.
Right.
Then that's what I'm concerned about.
Yeah, sure. Although I have to say that now that they have caught it, the level of suspicion will probably be higher.
Yeah.
So, I think that's a good thing too, that once they know you have it, everybody's going to be a little more vigilant. So, kind of you being a good reporter of any symptoms you're having, any changes you've noticed, kind of being able to supply them with as much data from your end, and then their level of suspicion is going to be higher too. So I think that's probably a good way to look at it. Yeah. I have some questions from people who are online. So why don't I go through those, and then if we have any more here, we can do that. Somebody asked, are there practical tips for not obsessing over CT scans and CA-125s and live in the moment? Yes. I think the mindfulness meditation is a really good direction in that place, because obviously the results of the scans and the blood work is sort of out of your control. So in lines of controlling what you can control, keeping your mind focused on the present rather than kind of getting on that train of what if the scan is this, what if the CA-125 is up, and just kind of being in the moment is probably your best bet. I think as the scans or the blood work get closer, distraction is going to be your best friend. Again, not exclusively, you don't want to be distracting exclusively, but if that test is coming up in a week, it may just be a good week to binge watch something on Netflix or anything that keeps your mind busy. I know people are like watching Stranger Things now on Netflix. So I think if you can't do anything to control that outcome leading up to the test, kind of keep your mind focused on other stuff. And interestingly, not that you can necessarily take this up right before your scans, but Volunteering is a great way to distract yourself and feel good about things because it takes you outside of yourself. So there's a lot of research to suggest that doing volunteer activities helps anxiety and helps keep your mind busy in a productive way. So over time, you may just want to kind of pick up some volunteer stuff too to throw yourself into in that time leading up to the tests. Another person, we answered the one about mindfulness, good. There's a question about, are the chances of ovarian cancer recurrence higher? So is the fear of cancer recurrence in this group greater? Given that I'm not a medical doctor, I'm not allowed to answer medical questions, so I can't tell you if the chances of ovarian recurrence are higher. I can tell you that I believe the research supports the fact that in cancers that are more likely to recur, you may have more fear of recurrence. And on the flip side, if you have a cancer that's very unlikely to recur, your fear of recurrence is probably lower. So if, in fact, you have a cancer that has a higher chance of recurrence, you probably would be more vulnerable to fear of cancer recurrence. Let's see. As far as someone wanted to also know, later stage versus early stage. Again, it's variable. I think there are people with late stage cancers that fear that it'll get worse. There are people with early stage cancers that fear that it will get worse. And my sense is it's probably not necessarily based so much on what stage you're in as to some of the factors like trait anxiety. Like if you're an anxious person in general, then no matter what stage your cancer is, you're probably going to be more anxious about recurrence. So I think there are probably factors that affect it more than just stage itself. Somebody wanted to know about sharing their fear with their family and how to talk about it with family. I'm personally, just based on general experience, the kind of person that thinks the truth will set you free. So that being said, I think that probably family members also experience fear that your cancer might recur. And a lot of people, I think, try to protect each other by not talking about that because there's a sense that if you acknowledge negative things, then bad things will happen. Like if I'm not positive, my cancer's going to come back. Like if I don't have a positive attitude, I'm going to have a recurrence. So a lot of times people will keep negative feelings inside, both the patient and the family. Like maybe your spouse doesn't want to upset you by saying, oh, I'm kind of afraid of what happens if your cancer recurs. Or the patient might think, well, I don't want to burden my spouse or my kids with these fears. But I think by and large, it's better to just put it out there because you may find that if other people share that fear, then you don't feel so alone in it. And if other people share their feelings about it, maybe you can put your heads together and come up with a solution that you couldn't come up with on your own. So I think there's a lot of benefits to putting those fears out there. And interestingly, a lot of people tell me that just saying them out loud to somebody makes you feel better about them. Like sometimes when you hear yourself say something out loud, it's like, did I really think that? Or, oh, I found out that's normal, so it's okay. So I'm a proponent of sharing it. And I think there's maybe a look for, not teachable moments, but maybe you look for times where it's more logical. Like, say, for example, you do have a test coming up. That might be a logical time to say, boy, I have my blood work coming up, or I have my scan coming up. I'm kind of worried about it. Are you worried about it? Just kind of putting it out there in that way based on if there's some logical time to talk about it. Let's see. Another question from online is, what about scanxiety? For those who have scans every 3 months, the days before, the day of, and the waiting for results. Yeah, I mean, those 3-month scans are like a double-edged sword because you do have anxiety leading up to it. hopefully if the results are good, it goes down, but then you're facing another one in 3 months. So you could look at it as, I'm getting anxious every 3 months, or you could look at it as, I'm getting reassurance every 3 months. Either way, it's anxiety provoking. I would say, again, it sort of is depends on how much the scanxiety affects you. If it's a couple days before I feel kind of anxious, and a couple days after while I'm waiting for the results I'm kind of anxious, but most of the time in those 3 months I'm okay. You may not have to do too much about that other than maybe just kick in a few extra relaxation practices or whatever. If that anxiety is filling up a lot of that 3-month period, it may be a good idea to talk to a professional or a paraprofessional about looking at some specific skills, which may be some of the cognitive behavioral therapy skills, the mindfulness skills, the exposure therapy skills. And some people, and again, I'm not a physician, so I can't speak specifically about medications, but for people who are kind of highly anxious anyway, there are various classes of medications that can help with that. So that might be something to discuss with one of your physicians too. Is there something medication-wise that I can do? And if you look at the research, kind of medication is helpful, skills are helpful, the two together are even more helpful. So there's a lot out there depending on how much it's affecting you. Those are the ones from online. Oops, sorry. Any other ones from here or Passivant?
Passivant, you covered everything. We really appreciate it.
Oh, awesome.
Susan.
Yeah, thanks for being there. My friends out in the north. Okay. Well, thanks everybody for coming. I hope it was helpful, and have a good trip home.